struggling with mental health or struggling with you're in crisis because your child is not able to meet the needs of your child, or you're overwhelmed, then you can go to a CRCG meeting and staffed by professionals from juvenile probation, Texas workforce, mental health authority, education people, Region 10, and we all sit on the health and CPS. There's every agency that's represented there, and we try to sit there and solve the issues as best we can and make recommendations based on our expertise and knowing all this. And we've had a lot of success stories in there. And the cases we've dealt with are, very, very difficult. And Carolina is a superstar on that committee because being a representative of the LIDA, which is Local Intellectual Disability, whatever that stands for. She gets the hardest cases of Metrocare, and Metrocare covers a big part of Dallas, which she's going to talk about, but she really meets the needs of the families as best she can. She really cares. And one of the things I've learned in the 5 years of doing this is that you've either got people with passion or you got people just doing check boxes. And she's definitely a passion person. And everybody that we have on this panel today are passionate people, because that's the people I respect. And that's the people that I really want to be involved with, because that helps us and it helps all of you. So we're going to get Carolina on, and hopefully that she's ready to go. And
yes, I am. Good morning, Jim. Good morning, everyone.
Voice in the sky, the voice in the sky.
And I was trying to get my lighting going. Maybe that's better.
Oh, so do we have
the camera?
Our mood lighting, the ring, and all that kind of stuff that we have to have nowadays?
Yes.
So we're not going to work.
Thank you, Jim. Good morning, everyone. And Jim, thank you for that introduction. So again, yes, my name is Carolina Lasso. I am actually one of the program managers here at Metrocare within the Local Intellectual Disability, Developmental Disability Authority. I'm the manager over the waiver programs, our HCS and Texas Home Living waiver programs here at Metrocare. So I know we have a lot of presentations, so I am going to go ahead and get started with my PowerPoint. So just give me a few minutes. Okay, so Metrocare Services, if you all are familiar with the agency, we were established back in May of 1967, and we are one of 39 community centers within the state of Texas. And we provide, on top of IDD services, we also provide mental health services for Dallas County residents. And a group of parents who basically wanted to find better services for their children with developmental disabilities were involved in the development of Metrocare Services, just like a lot of other community centers throughout the state. Metrocare is very unique because we do provide clinical services for individuals from birth to death. Again, we provide mental health services for children, adolescents, and adults. We also have our intellectual and developmental disability services. We also have substance abuse and crisis intervention services, primary care and pharmaceutical services, and we also have veteran and housing services. We have several locations throughout the state, throughout Dallas County. We have several different clinics. We have our we have our autism clinics as well, that are in different parts of the northern part and southern part of Dallas County. So we can try to serve the entire community. Dallas Metrocare also is the first certified community behavioral health clinic. We recently became certified for NCQA. And this is a certification that we are applying specifically for our local intellectual disability authority. And basically the goal with NCQA for us and with our IDD individuals is we are trying to provide quality care for them. And so with this accreditation, we are ensuring that we are not just looking at services for the person. Our goal is to look at the whole person, the whole person. So in regards to health, in regards to social needs, mental health needs, NCQA and that accreditation is helping ensure that our service coordinators are trained to know how to basically assess the person and ensure that we are looking at the full person. We also have our CARF accreditation, which again is to ensure that we are providing quality care for everyone that we serve. Okay. In regards to our IDD spectrum services, again, we begin from ages 0 to death. So our Metrocare does have an early childhood intervention program, and that starts with ages 0 to 3. And typically some of the kiddos that are in our early childhood intervention program, if they have a diagnosis of autism, they do and they can transition or begin receiving services through our Centers for Children with Autism. And they serve individuals or children from the ages of 2 to 12. And again, we have one location. We try to make sure we have locations on 2 sides of the county. Dallas is huge. So we have a location in the northern part and in the southern part of town to try to ensure that we can serve the Dallas County as a whole. We also have our behavior treatment services, which begin serving children from ages 3 on up. And for our older adolescents, we do have the Career Design and Development Services Center, which is for 18 and up. And they're going to provide a lot of vocational services as well as rehabilitation services for those that are in school or in the process of aging out of school. And so if the goal or the outcome for the person is to work in the community, our career design and developmental services will help the person with career, helping them to find a career or job that they would like. They also work very closely with Texas Workforce Commission to help the person with training as well as looking for jobs in the community. And then we also have our Medicaid waiver programs, and it says 0 to 3. I think that's a typo, but our Medicaid waiver programs can serve and typically serve over the age of 3. So let's talk about the local intellectual and developmental disability authority. It is very important that the community know and understand that if you have a loved one who has a diagnosis of an intellectual and developmental disability, that they contact their local intellectual disability authority to initiate that process. The LIDA is the front door to 2 of the Medicaid waiver programs in the state of Texas, and that is the HCS waiver program and the Texas Home Living waiver programs. When you determine, or when it's been determined that the person has an IDD diagnosis or related condition, the first step is to contact the eligibility and determination unit. Every local authority in the state of Texas will have an eligibility and determination unit. And their job is to determine if an individual is eligible for IDD services as it's been outlined by Health and Human Services in the state of Texas. So they aren't going to diagnose the person. Their goal is to determine if the person meets the criteria that has been outlined by Health and Human Services. They are also, when they complete what's called a DID, Developmental Intellectual Disability assessment, they're also going to, the clinician would determine the individual's level of function. They can't do IQ testing if that information wasn't provided, adaptive functioning, etc. And they're going to determine if, based on those assessments that they are reviewing and additional assessments or testing that they may do, if they qualify for those services. If they do, a few things can happen. They can, place the person on the wait list for HCS, Home and Community-Based Waiver Services, and or Texas Home Living. Or if the person is in need of services, they can be referred to service coordination for immediate services. They can also be placed on the general revenue wait list as well. The eligibility and determination unit is also going to conduct any type of guardianship assessments that may be needed once the person turns 18, and if the family is seeking guardianship. At times they do have to go back through EDU if they need an updated DID. Let's see. So that's our eligibility determination unit. And then we also have specialty programs that we are going to go into detail in the next slides for the LIDA. So we are going to talk about our general revenue programs, community first choice, continuity of services, and PASAR. So starting off with our general revenue program, typically speaking, after the person comes through EDU, general revenue is typically the first program that they would go to if they're seeking those services. So once a person is eligible and they, for instance, are seeking respite services, behavioral supports, or residential placement, then they will be referred to a general revenue service coordinator who is going to help them access medical services if needed, social, educational, and other services and supports, such as the ones that we previously discussed. What our service coordinators do is they complete several different assessments using person-centered planning to try to determine what the person's needs are and what services can best support the person. General revenue is typically funds of last resort, and those funds are limited. So some of the barriers in general revenue are simply that because they are funds of last resort, we don't always have a lot of funding. And it's important to know that general revenue funding looks different in different local authorities. So just want to put that out there, depending on where the person lives, it does look different in regards to how that local authority manages those general revenue funds. Here in Dallas County, one of the things that we can immediately provide through general revenue is behavioral supports and residential placement. We also have some dollars for respite. But general revenue can also provide day habilitation services, vocational services, any type of specialized therapy if needed, but there are waiting lists for those programs at this time. The next program within the local authority is the Community First Choice Waiver Program. And it's actually a non-waiver program, so I apologize. And it is specific for individuals who receive Medicaid and have a managed care organization. And what Community First Choice is going to provide is personal assistance services and or habilitation services. And that is basically so someone can go into the home and assist the person with activities of daily living, such as eating, toileting, grooming, dressing, bathing, or those independent living skills such as meal preparation, and planning, financial management, or other health-related tasks. Again, the important thing to know with Community First Choice is you have to be a Medicaid recipient and you have to have a managed care organization. Here in Dallas County, for adults over the age of 21, the two managed care organizations are Superior Health and Molina. For those under the age of 21, it is Aetna and Amerigroup. So families can request Community First Choice through their managed care organization, and they can submit that referral. The managed care organization will submit that referral to their local authority, which in this case would be Metrocare. And or the family can also come directly through the local authority if they are looking for Community First Choice services. But again, the requirement is that they do have to be Medicaid eligible and have a managed care organization associated with their Medicaid. The service coordinators in the Community First Choice program work very closely with the service coordinators with the managed care organizations. The service coordinator would complete an assessment for CFC to determine what the person can do and what they need supports in when it relates to their activities of daily living. Overall, it is the managed care organizations that approve those Community First Choice hours. The local authority is responsible for monitoring those services and also renewing those Community First Choice services on an annual basis. But overall, the managed care organizations approve the hours that the person would qualify for during that plan year. What I also want to add is our individuals who receive Community First Choice, they can also receive general revenue services. So for instance, if they are also in need of respite and that's something that is available and we can provide, they can still get respite and get Community First Choice. Or if they are in need of behavioral services, we're also going to provide, they can also receive Community First Choice. Then we have our Continuity of Services department. And our Continuity of Service department they're responsible for enrolling individuals in the Home and Community-Based Waiver Program or the Texas Home Living Waiver Programs. So once Health and Human Services releases slots for either of those waivers, it's going to be that department that manages the entire enrollment process for that particular person. Again, when it comes to enrollments and how that works, each local authority does do it different. We specifically have a department, because Dallas County is so big, that manages a lot of those enrollments. Lastly, we have our PASAR department. PASAR stands for Pre-Screening, Admission Screening, and Resident Review. And with this particular program, it is federally mandated. It is closely monitored. And basically what PASAR is, it requires that all states pre-screen all people, regardless of the payer source, who are seeking admission into a Medicaid certified nursing facility. And so it's for any eligible child or adult who has IDD and or mental illness. And the local authority will work closely with nursing facilities to ensure that the person has appropriate placement and that they have all the necessary services and supports that they are going to need while they are in that nursing facility. Or they're going to also try to ensure that the person receives the necessary services and supports once they transition out of the nursing facility. And I think the thing with PASAR that I like to make sure that people understand is that it's to ensure that we're keeping a closer eye on our individuals when they're in nursing facilities. Basically, what was happening back in the day was a lot of individuals who had intellectual disabilities or mental health were ending up in nursing facilities and they just weren't receiving the services that they needed. Or they would come back out into the community and still not have those services. So that's what PASAR does. Those service coordinators in that program monitor those cases very closely. The goal is typically always to try to get the person to come back out into the community. But if they can't, for whatever reason, it's just to ensure that they have all the supports that they would need. So again, they're working very closely with the nursing facilities. I think at times nursing facilities have a negative stigma. And so there are times where a nursing facility may be the best option for the person, but it is difficult for families to go that route simply because of, experiences they may have had in the past or things that they've heard. But I think the good thing to know that if that is the route, that they're not in the nursing facility without any type of rehabilitation. So if they need specialized therapies, they're going to get that. Because again, the goal is to ensure they have everything that they need while they're there and to help them transition back out into the community. All right, now we're going to go into a little bit more detail about our the Medicaid waiver program, HCS, and Texas Home Living. All right, so the HCS waiver program, or Home and Community-Based Waiver Program, is probably the most it's the most sought after program for a lot of our individuals who have intellectual disabilities. And so it is a Medicaid waiver program. It began in 1985, and it is considered the Cadillac of waiver services. And basically it's just because of the amount of services that an individual has access to. It says that, and I think I beg to differ, it probably is a little bit closer to 15 years, but it is a long wait list. Right now, I would say it's probably around 15 years or so. So it's very important that families are placing their loved ones on the wait list early. I can't stress that enough. And I know it can be difficult for a lot of families because you do go through the process of, at times, accepting, that their child is, gonna need a little bit more supports than others. And so what we see is that families have a tendency to wait because maybe they still haven't accepted the diagnosis that their child has. And or a lot of times what we see is that because they are receiving the necessary services and supports that they may need at that time, they feel like they can wait until, they age out of school, or until, they no longer have whatever program they're currently in. But we always encourage just to do that early on because you never know when you're going to need these services. So with HCS, it's going to provide and the goal is to provide individualized services and supports for the person. They can receive those services still living in their family's home and their own homes, or in community settings, such as small group homes. In HCS, what makes HCS group homes very different than your intermediate care group homes are that they are smaller. Your HCS group homes are typically no more than 3 to 4 people, whereas an intermediate care facility group home can have they can be way more than 4 people in a home. So that's an advantage to HCS. The local IDD authority does provide the service coordination for HCS. That is something that is required. And I think it's important to say, because when a few years ago, that wasn't the case. A lot of the service coordination was still being provided by providers, HCS providers. I think that changed around 2010. So that is a requirement of the program. All right, so in regards to the residential components that HCS can provide, HCS also provides CFC, personal attendant services or rehabilitation services. So that would allow for the staff to work with the individual in their home, to support them and facilitate their abilities to improve on their activities of daily living. There's also it used to be called foster care option. A lot of people still refer it to foster care, but it's actually host home companion care. And it also allows a person to live in their natural home after the age of 18. And the parent or whomever can basically get reimbursed for caring for them. There are also host home companion care options with that providers have families that are willing to do those options with a lot of our individuals. And typically during the host home option, a lot of times it's typically just that individual, and it's to help them feel like it's a family environment. So that's the best way I could probably describe that option. Then we have our supervised living and residential support services. So those services are provided in 3 or 4 bed group homes. Metrocare currently has a 3-bed group home and 1 3-bed crisis respite home that I want to put out there, and we will talk about crisis services later on. But in the group home options are referred to as supervised living or residential support services. And one of the differences between supervised living and residential support services is that residential support services are for someone that requires 24-hour care. Supervised living is typically for a person who may not need as much support. They just need some assistance with their activities of daily living and their staff available when that person needs it, but there's always someone there at night. So that's one of the differences with those 2 components. And then there's also respite, which provides for planned or emergency short-term relief for the unpaid caregiver if necessary. There's also some other community living options, such as dehabilitation, which allows the person to continue to improve on those self-help skills, socialization skills, or adaptive skills. There's supported employment if that's something that's needed, or employment assistance. And then we also have our professional and technical supports, such as skilled nursing, the behavioral supports, physical and occupational therapy, dietary, speech. The other interesting thing about HCS is that it also assists with minor home modifications that would help the person become independent. So for instance, if maybe, let's just say the person is unable to get in and out of the shower because the bathroom isn't big enough, or maybe they need a walk-in shower, then with minor home modifications, they can do that. Or if they need a ramp in the home, or possibly if they need to widen the doors in the home, to make it easier for the person to come in and out of the home. Those are some examples of some minor home modifications that are approved through the HCS program. It also pays for adaptive aids and dental treatment. After the age of 21, Medicaid typically stops paying for dental. So in HCS, they can continue to receive dental services, and it pays up to $2,000 a year, which is very beneficial because we have a lot of our IDD population needs sedation just for cleanings. So the dental funds really do help with that. Next, we'll talk about our Texas Home Living Waiver Program. Texas Home Living is very similar to HCS, but the difference is that it's a smaller waiver. So in Texas Home Living, you can only receive up to $17,000 a year in services. And Texas Home Living does not have a residential component. So what that means is the person has to live in their own home or in their family home. So they can't go into a group home and receive Texas Home Living services. They can't go into a nursing facility and receive Texas Home Living services. But it does provide the community first choice services. It provides employment assistance, rehabilitation, respite, the specialized therapies. It also provides the minor home modification, and the amounts are the same for both programs. It's about $7,500 throughout the lifetime that the person is in Texas Home Living or HCS. And it also provides adaptive aids as well, and dental. The only difference is, again, Texas Home Living is smaller. So where HCS would pay $2,000 a year in dental, Texas Home Living only pays $1,000. So those are some of the differences in the two programs, in the two Medicaid waiver programs. So again, the local authorities throughout the state of Texas manage the Texas Home Living and HCS interest lists. There at one point wasn't an interest list for Texas Home Living, but I want to say we're in 2001, so maybe around 2016, 2017, Health and Human Services did create a Texas Home Living wait list. And basically what they did was, based on the people that were on the HCS interest list, they also placed those individuals on the Texas Home Living wait list automatically. But then after that, the local authorities do offer the Texas Home Living interest list and explain that to the family so that they can place the person on the list if they choose so. So that wait list right now, I would say, I think they're 7-8 years. I think that's my understanding, that it takes 7 to 8 years for a person to receive Texas Home Living slots. So that may change soon, not sure. Okay, and then, okay. The last thing that I wanted to talk about, and this is something that Metrocare has, but a lot of other local authorities also have crisis programs. So our crisis programs are, Health and Human Services has designated some funds for a lot of the local authorities within the state of Texas to be able to provide crisis services for our individuals. And what that consists of is crisis respite. So for 14 days, if the person is at risk of having a crisis, and the person can go into a crisis respite home for 14 days where they'll receive that 24-hour supervision. And then they also receive crisis intervention services to help manage the crisis and help reduce some of those behaviors. And then there's also a transitional support team that is part of the crisis program. And what the transitional support team does, it's a group of professionals. Usually for us, we have a psychiatrist, we have one of our BCBAs and other professionals involved in our transitional support team that basically looks at the person, what's going on with them medically, what medications they're taking, what type of behaviors are they exhibiting, and they look at if the issue is related to medication or if they need a specific, maybe they're in need of some intensive behavioral program, et cetera. So they're going to give those recommendations depending on what's going on with the person. So, and while the person is in our crisis respite home, some of those considerations that were, or those recommendations that were given by the transitional support team are taken into consideration. So for instance, if there's concerns about the medication that's being provided or the dosage, if that's one of the recommendations, they may look, we want to ensure that the person gets lab work, and our psychiatrist or someone in our clinics may work at trying to work with the person and their medications. Or if they feel like, maybe this is more neurological, and they can recommend that they go see a neurologist, or if it's any other medical issues that need to be, that should be considered or looked at, then they're also going to make those recommendations. And along with the service coordinator and other members of the team, they're going to ensure that we at least look at if it's submitting referrals or working with their Medicaid MCO. We're going to make sure that the person gets whatever referrals or completed to rule out any other medical conditions that are causing the person to go into the current crisis situation that they're in. During the 14 days of respite, while they're also receiving intensive behavioral services, they may also go to our behavior treatment center, which also it's kind of set up kind of like a day hab setting, but they're also working on behaviors and socialization skills with the person while they're in the 14 days of respite. There are times that we do have to extend the 14 days of crisis respite, just depending on what's going on. But that is a service that is available to all of our individuals. And of course, due to COVID, we have seen a huge increase in individuals needing to access our crisis services. But our goal is to try to stabilize the person as best as possible, and to decrease them being readmitted into psychiatric facilities and or correctional facilities. So while we try to utilize our crisis services as a preventative measure, meaning if the family or the individual is reporting a certain concerns, we can try to reach out to our crisis team before the situation reaches a psychiatric, before the situation involves the person having to go into a psychiatric facility and or having police involvement. So that's always the goal. Unfortunately, sometimes it just happens where they are already in crisis. And so we are, trying to just keep the person safe and others safe. And that's when our crisis team has to step in. So, but that is our crisis program. Are there any questions that you guys may have?
We do have some questions. And they'll be in the Q&A. I can't read them from here, so one of you two are gonna have to do that for me.
Okay.
And then I'll join in with you in answering.
Okay.
Do you want to do your poll first?
All right. Please, we're gonna launch a poll. This is a very quick survey. And then you guys here in the room have a sheet at the end that you can turn in. One reason we have to do the polls or surveys is that since we're funded by the Department of Education, we have to show that we're doing work, show how the quality of the work we're doing, and we have to prove that we deserve to continue to earn this grant. So if you can answer these 4 questions to make my boss very, very happy, that would be great. And in the room, there's a sheet that has a overall for the whole presentation that we can get from you at the end too.
Okay. Let me start off with the questions. So the first question was, what options are there for children who are about to turn 13 or for children between 13 and 18? So it honestly just depends. But if they're in need of general revenue services, that is one option. Again, that program is very limited. And I say that it depends because it depends on what's going on with the person. I think one of the benefits, if the person is under the age of 21, Medicaid can still provide a lot of services and supports for them. And that's typically what a lot of families are using is their whatever resources are available through Medicaid, depending on what's going on. But if for whatever reason you do have a child between those ages that needs more support than what Medicaid can provide, what we do recommend is going to the CRCG or submitting a CRCG referral, and we can review the case and try to determine what's going on with the individual and provide additional supports. If it's a psychiatric issue, then of course, seeing if medication can be provided to help along with therapy would be beneficial. There is, depending on the situation or the person's diagnosis, there are also other waivers, such as Yes Waiver, that can provide some supports to families and to the individual while they're in the home. So again, I think we would just need to know what the person needs to actually tell you what's out there. The second question is, who pays for this if you don't have Medicaid? So general revenue dollars can pay for some services if the person does not have Medicaid. And that is, I can speak for Metrocare. Again, I don't know what the requirement is for other local authorities when it comes to a person not having Medicaid. So that can vary, and that's very important to know that certain centers do manage their general revenue funding very differently. The other question is, how much is it if they don't accept Medicaid? So everything, we do work off of a sliding scale. So it would just depend on the family's income and what they can afford in regards to being able to pay for certain services. So we do work off of the sliding scale. The other question that Elizabeth had was also, is there a similar facility to Metrocare that's located in Tarrant County? Yes, there is. So you would contact Tarrant County MHMR, which stands for My Health, My Resource, Tarrant County My Health, My Resource. They would be able to assist you if you live within Tarrant County. So I hope that answers all your questions. Stephen wanted to know, regarding the LIDAs and EDU process, who does the guardianship assessment? What type of professional? So if you are seeking guardianship for your child or your loved one, typically it's a licensed professional that would need to complete the guardianship assessment within the local authority. And so from my understanding and what I know, and I would refer you back to the eligibility and determination unit if you have more questions about that. But a lot of times I think the current DID that's completed or assessment that the local authorities use, I want to say it's good for 3 to 5 years. I know that kind of changed, and that's something I'd have to verify with that clinician. But typically, if it's within 3 to 5 years, most attorneys can use that when they're completing the guardianship assessment. If it's longer than that, then they will want the parents to come through the eligibility and determination unit to get an updated one, but it is completed by a licensed clinician. Okay, the other question was, what does the HCS wait list mean? Waiting for what? For signing up to participate? So great question. So basically what the wait list is, it's you are waiting to have access to HCS services or to get a slot. So just because you're placed on the wait list or the interest list, let me say that it's called an interest list, that doesn't guarantee that the person would qualify for services. It is basically placing your name on the interest list for this particular program. And let's just say my name was placed on the HCS interest list back in 2007, and the state is now releasing slots from that interest list. A letter gets sent out letting you know the state has released slots, you know, your name has come off of our wait list, and someone from the local authority will be in contact with you in regards to your slot. And typically and that's the continuity of services department. What they're going to do is they're going to explain the HCS program to you, what services and supports are available. And if the person needs to go through EDU for testing, you will have to go through EDU for testing, and that's to get that that determination of intellectual disability. And once that is completed, and depending on those results, you can go through the whole entire enrollment process, but ultimately Health and Human Services is going to let you know if you qualify for HCS or not. It's not the local authorities. So the interest list is putting your name on the list for that program, but you still have to go through the whole enrollment process. So I hope that explains that question.
Hey, Carolina, can you talk about if a family moves from one county to another county, what the process would be?
Repeat that for me, Jim.
If somebody moves from Dallas County to Denton County.
Oh, yes. So it's very important that if you are moving from one county to another, if your name or your child's name is already on the interest list in that county, their slot does need to be moved to that new county. So you would need to contact the new local authority or your old local authority, letting them know that you have moved and that you need to move your slot to that new county. The interest list for the HCS and Texas Home Living is statewide, and each county is different. So while, you know, here in Dallas County, your name, you could be 500 on the list. If you move to another county, that could change. But it's very important that you do notify the local authorities once you move, because whenever a slot is released, it's going to go to the county where that Health and Human Services shows you were last at, but it has to be moved. Does that make sense?
Yes.
Okay.
One of our questions before you got on, I think, was somebody had moved to Bexar County and they're having difficulty getting hold of them.
They're having difficulty doing what? I'm sorry.
to physically get hold of them to return their phone call. Do you have any recommendations to how they can move forward, just to keep calling, or to maybe show up in person, or?
You can do that, or you could also contact Health and Human Services and let them know. They will reach out to that local authority themselves. Or I would recommend contacting your old local authority, because we do that at times. We will actually contact the new local authority, letting them know this person moved on this date, this is the contact information. And because both local authorities should be in contact anyway to transfer that that interest list over.
Are there other questions?
If you don't live in Metrocare's for Dallas County, we're Rockwall County, where do we go to?
Okay, go ahead.
If I'm not mistaken, Rockwall County is Lakes Regional?
Yes.
Yes, yes.
Yeah. In the chat, I also put a link to the HSS that has, I guess you guys don't have it here in the room, but you go to HSS and say, find my local authority, health authority, or LIDA, Local Intellectual Disability Authority, and it will list all the counties on all the contact numbers there.
Yes.
And we have another question in the room.
Is this the contact number for Metrocare?
You have a contact number for Metrocare?
So I did, Jim, in the email, I did send the contact information for our EDU department and how to access services through the EDU department. So phone numbers would just depend on what it is that you're looking for. But
Okay,
yes.
So that's going to be the handouts that we'll have in our live minder after the meeting. We have a handout. She put all the phone numbers for Metrocare, and after the meeting, we'll send you the link to that folder, and that document will be there with all those phone numbers.
What was the name in Rockwall County that?
Lakes Regional.
Okay, thank you.
And it's important to know that, so Dallas, we're one huge county, Tarrant County is one huge county, so they have one local authority. But Lakes, for instance, they cover several different counties. And so some local authorities aren't just covering one county, they cover more than one.
Yeah, I believe they cover Kaufman, Hunt, and maybe Ellis, I think.
Yeah.
And what did you say you go to look for your particular county?
You go to Health and Human Services. If you just Google Texas HCS wait list, that will take you to a link that will look up your local authority. And that information will also be in the handouts that we give in the book, in the folder. Yes.
So does Metrocare have any kind of partnership with the local schools, similar to what Texas Workforce does with the VR counselors, to help get this information out to families?
Well, we definitely, so we do. I'm not sure if they're necessarily partnerships, but we definitely do our best to connect with a lot of the school districts. I've been with Metrocare for 14 years, and as a service coordinator, when I started off as a service coordinator, I would attend ARD meetings for the individuals that we serve. We also do participate in a lot of transition fairs. So we definitely do our best to try to connect with districts. What I will say is that there are times in which the districts don't always want the local authorities involved, but for the most part, we really do. I think Garland ISD was one that would always contact us anytime they had a student that was transitioning, or if they had any ARD meetings for a lot of their individuals, to make sure that we provided. And some schools in Dallas do that as well. So it really does depend, but we really do try to do our best to make sure that we are connected with schools and that they know what it is that we can provide.
Go ahead.
Follow-up question. So because I'm with Richardson ISD in the transition program, and if I wanted to start partnering more with Metrocare, is there a specific way to sort of reach out, or sort of specific person or in that department, somebody in a department to reach out to?
Yes, and what school district did you say you were with?
Richardson ISD?
Oh, with Richardson, yes. So I can give you my contact information and then also my supervisor's information. I would recommend you contact Ms. Thompson first and or me, and we can coordinate that.
Excellent, thank you.
You're welcome.
Have that question? Yes.
I contacted Metro Services and they've asked for financial background. Eligibility is based on the parent's income or the child that just turned 18 income like Medicare does?
That's a
I'm
good
sorry.
question. That's a good question. So yes, so we are required to obtain financial information. And so if the child is under the age of 18, it is going to be parents' income. If they are over the age of 18, it would be the child, the individual's, the adult's income.
Even if you have guardianship?
Even if you have guardianship, it doesn't matter. They're still they're over 18 years old. So the parent's income doesn't matter at that point.
Thank you.
One of the questions that was brought up earlier online was by Stephen Olivan. He is an attorney with Disability Rights of Texas. If you have guardianship questions or supported decision-making questions about which way to go, which is more appropriate for your child, Disability Rights of Texas has great resources along with the ARC of Texas on how to explain that process, explain the criteria and the intentions of obtaining support for the individual as they turn 18 and the proper support. And so I wanted to say hi to Stephen because he's one of my heroes, and I've actually been a client as well of Disability Rights of Texas. They're a great resource. Anytime that your family is experiencing discrimination towards an individual with a disability, Disability Rights of Texas is a great organization. Also wanted to bring up SPED Tex and have Katrina talk about that as well. They're also another organization. They're funded by the TEA. They're there to answer all your questions on the education system. They are staffed by ex-special ed directors, coordinators, and so they have the expertise of behind the curtains at the school. So anytime I have difficult cases that we're dealing with procedurals or interpretations of procedures, I refer my families to contact SPED Tex to get the perspective of the TEA on how they interpret certain situations, let's put it that way. And also they refer to Partners Resource Network when they have situations where they feel like that the family could use some skills on how to advocate for their child and to bring in their perspective. And Katrina, do you want to?
Yeah, so like he was saying, our consultants they have a wealth of special education information and knowledge, and they can help you. They could connect you with Carolina. So if you had a question about Metrocare, they could help you find your transition network that you needed. If you had a question about your ARD, if the process went well, if there's things that seem a little strange, they can talk you kind of through the ARD process. They're going to give you resources that help you make good decisions for your kiddo. They're not going to give you advice, but they're going to keep you well informed so that you can make the best decisions for your situation. We have a call center, so you're talking to a real life person. And we also have a website that has a lot of good information on it. You can chat with the consultants on our website. We do so much with Partners Resource Network, and it's just a really good partnership.
Yeah. And
Carolina, we wanted Pam to be able to talk a little bit about CRCG, just because we might not be as familiar with that.
Yeah, I know that that's been mentioned a couple of times, and if you don't know what CRCG is, it's the Community Resource Coordination Group, And what it is different agencies that come together and they meet when a family or a student is in crisis. And what they do is they try to find what resources that each of the agencies may be able to provide so that we really try that students don't get into a residential facility or have to be removed from the home. But also, if that has to happen, it also needs to go through them, and then they would do the recommendations for the residential facility. They meet by county, and so each county has a, I don't know what it's called.
A chair.
A chair. Each county has a chair, and it should be that the school participates in that, but then it would be different agencies too. And we have someone at Region 10 whose name is Richard Heflin, and he is our representative for Region 10. So if you can't find your county chair, which should be online, and we can send you that link too, but Richard Heflin here at Region 10 is also the representative for this area, and he goes to all the counties. Yes.
Community Resource.
Coordination Group.
Yeah, I serve on Dallas, Kaufman, Rockwall, Collin, Grayson County, and Fannin County. And then Andrea is gonna start joining that, and she's gonna try to take probably Ellis County. I'm gonna add Hunt County.
And the other thing that I want to say about that too is that it's not just for students or kids with special needs that qualify for special ed services. So 504 students, just